Hello, my name is Brooklyn Mazur, and today I'll be presenting my closing remarks on the debate of the shift to virtual healthcare in rural and remote areas. The telehealth system currently in place for rural and remote areas does not provide sufficient quality care. Several challenges and barriers are in place that are limiting patients' ability to reach these systems consistently and effectively. My opponent has suggested that virtual care is a suitable option for rural and remote patients. Although telehealth is a suggested option for these patients, there needs to be more funding, research, and effort put in to develop a more widespread and trusted system. The current system in place comes along with diminished quality of care as many patients remain unable to access these telehealth services. Some of the most prevalent barriers to accessibility include lack of technical infrastructure in remote areas, the inability to utilize technology, and the inability to perform proper physical assessments of these patients. Research shows that less than 70% of rural populations have sufficient access to broadband internet, and even the patients that do have access, it often comes at costly rates. In addition, it has been established that rural areas contain higher rates of elderly people. This population often lacks the ability to utilize technology effectively and are distrusting of these services. This leaves them vulnerable to decreased healthcare through telehealth services. My opponent has pointed out that telephone appointments are an option to overcome internet and technical setup barriers. But is this really a good option for patients, or is it simply a quick fix to an improperly funded telehealth system? Telephone virtual appointments lead to the most concerning barrier of all, which is the lack of personability and inability to perform physical assessments on these patients. The Canadian Medical Association has already outlined numerous symptoms not amenable to virtual care, and physicians have begun to further compile more. Research from Vorenkamp and his colleagues pointed out certain patient populations, such as those with hearing and cognitive impairments, were at an elevated risk of miscommunication and misdiagnosis with telehealth. Additional research suggests that physicians have valid concerns with the inability to fully assess a patient's symptoms, and they feel that virtual health diminishes the ability to pick up on patients' nonverbal cues and form trusting relationships with patients. Two very important aspects of healthcare assessments. In summary, the rapid rise and shift to virtual healthcare in rural and remote settings is raising several concerns about the quality of care these patients are receiving. Moving forward, a more inclusive telehealth system needs to be considered that does not put patients at risk of more health inequity and disparity as the current system does. Thank you.